Whether that turned out to be general surgery or orthopedic surgery, it was going to be something hands-on. I think the thing that I've always liked about general surgery is the idea that we're coming in to fix a problem. And that problem's not the same problem for every patient. Generally, I meet you, we have an interaction, you have a problem that we think needs to be fixed, and hopefully it's something that we can surgically fix. I am actually really an old-fashioned general surgeon. We do a lot of intra-abdominal surgery through open techniques, through minimally invasive laparoscopic techniques, through robotic laparoscopic techniques. But I also still do endocrine surgery like thyroid surgery, parathyroid surgery, adrenal surgery, really kind of the whole gamut of what traditionally fell into general surgery. Most of the time I'm meeting these people for the first time. So we're reviewing their records, reviewing what has got them to that visit, discussing what their problems are and what the potential remedies for that are. There may be multiple different approaches or techniques for the exact same problem that you need to tailor to that patient based on the patient's particular problems, comorbidities, other health concerns, level of activity. There's a couple of areas where we strongly collaborate. We'll sit down amongst ourselves and say, hey, take a look at this CAT scan. What do you think about this? What do you think about that? What would be the best way to approach it? And that often continues all the way into the operating room. The collaboration becomes very complex with the emergency room physicians, the admitting medical physicians, often the ICU teams, and other medical specialties as we take care of complex patients with emergent problems. Seeing that patient back in the clinic after things are better. And then there's people whose stories last for years, and they're all equally rewarding. Those occasional hugs from the patients are pretty awesome. I've got 3 relatively young kids between ages 8 and 14. So usually most of my time outside of work is interacting with them, doing things with them.